I heard that Alcon is for sale. Could that be the case, Mike Ball?
Wow. So let's just be clear on exactly what Alcon. Alcon is selling stuff. Alcon, from again the Novartis standpoint, is in a strategic review, and the strategic review will go through this year with some update by the end of the year. From an Alcon perspective, the outcomes go all the way from being retained by Novartis to being spun out or IPO'd in a capital markets play. So, there's a whole range of possibilities there, but actually, I don't find it distracting one little bit. Our job is to keep this company moving forward, and all of our employees, our 20,000 employees, are dedicated to the same thing. So, at the end of the day, there needs to be decisions made, but again, it's not affecting us one iota.
So is that a pretty good answer? Huh? Way to go. Ludwin, tell us what it's like to be a German company.
Interesting question. Well, being a German company, first of all, means we are headquartered in Germany. Right?
Oh, okay. Very factual.
But I tell you, we are a very international company. I don't know if you know that, we have 1/3 of our revenues in Americas, 1/3 in Europe, and 1/3 in Asia, right? So you could say, well, it's still a German company. I tell you that we have more people outside Germany than in Germany. Our largest site actually is in the US and not in Germany. We develop products in 3 continents. In Asia, in Europe, and in America. So I believe we are truly international. But however, it's certainly true that, there is some German impact, right? You hear it in my accent. Sorry for that. So that is one part of it.
Can everyone understand Ludwin okay?
I hope so. But I believe it's also the company itself. Zeiss is truly an interesting company. I don't know if that's German. I can just tell you that we are very innovation technology focused. Business ethics is very important for us. It comes a little bit back to what we discussed before, long-term thinking. Very open-minded. So it's this set of values that, I don't know if that's German, but at least this is what makes up Zeiss.
Tom Burns, things are going pretty well. Went public, raised money, turned profitable, growing fast. Looks like you might be an acquisition target. What do you think? I've heard the analysts ask you this.
Yeah, that's the rumor. What I would tell you is that, I think that to Tom's earlier point when he was talking about companies that have taken a look at us, we've been looked at and looked over for many, many years. And one of the reasons that we went public is that we just couldn't to meet the right strike price that would make a difference for an acquirer to take us over. But I think now that we've gone over the threshold, we've pulled on our own capital, we have invested. We have now 3 open IDs and 1 open IND. So we have organically generated 4 products that will follow our major product. We're heading into a whole new area of drug delivery, which has just untapped, unforeseen, and potentially incredible value. And so I think it would be difficult. I really do believe that for an acquirer to be able to step up to reach what I think would be a very, very aspirational target. So we plan on being, right now we're kind of in the, I call it a light middleweight stage. We plan on growing to be a heavy middleweight and maybe someday building a company that will be with the ranks with some of these senior gentlemen here today. So my goal is to keep my head down, and our company's goal is to keep our head down, build a formidable business. We're focused in glaucoma first, but as we said before, we tend to be relatively dangerous both in the front and the back of the eye. And we have other plans and other aspirations, and I plan to make that a reality.
Joe, quite a bit of publicity about Valiant. You've had some ups and downs. You came in recently, and I'm sure you get lots of questions about how stable, how financially strong, et cetera. What do you say?
So Valiant's had some challenges, to be clear. My predecessor left me with a little debt that I had to clear up. We had about $32 billion of debt, but to be fair, in the 12 months I've been there, we've been able to pay $3.6 billion of the debt already. So we're well on our way, and we don't have to get the debt to zero. We just need to get the debt to somewhere in the, let's call it $15 to $20 billion. What I said when I joined is that it's not like flipping a light switch. It's going to take some time. I think it's a 3-year type process. The first stage was to stabilize the company. We had a little bit of noise in the marketplace on some of the commentaries, but we've done that. I think we've stabilized it. Now we enter into what I would refer to as a turnaround phase, and the turnaround phase for me is all about just repairing the business, getting the business focused on launching new products, which, as I said, we're very fortunate with the Stellaris Elite product, get that out, with the Vitesse, with later this year, hopefully we got a PDUFA date on our Vyzulta, the latanoprostene Bunad. Those are what's going to be important. And we, along the way, we changed the mission. We changed the mission to say that our mission is to improve patients' lives. If we do that, we're going to be successful. And to me, that's what I try to talk about with the team. Focus on how we launch these new products. Focus on paying down some debt because we need to. And importantly, continue to do what I call blocking and tackling. That's what's going to make us successful.
Perry, you did a big acquisition, stretched a bit financially to do it. I've heard some rumblings that, well, you can't do a few things now because you're a bit stretched financially. What do you say?
I think I heard the same rumblings, and I'll refer you back to Monday. We actually put out a press release of a collaborative licensing agreement with Perion, specifically focused in this space. So I think there are great rumblings. If there is a strategic fit, and specifically in one of our areas of focus, we will always evaluate and make sure that if it has an unmet need or a novel mechanism of action, we would like to look at it and see how we can bring it into the Shire family.
Tom Frenzy, you've just been bought. How distracting is that?
Not really. Not very distracting at all, because I think the bringing a committed parent like Johnson & Johnson back to the field of ophthalmology is not distracting, it's very encouraging. And to have the depth and breadth of the resources that J&J can bring and add to the AMO franchise that has really been driving the business very nicely over the last couple of years, I think is a wonderful combination. And to have a committed parent that really is invested in the vision space. And when you think about the unmet need out there, 50% of the world population could benefit from vision correction, only 10% have been treated. What a wonderful opportunity we have to leverage now with the contact lens business as part of the portfolio. Everyone from a young emerging myope that's 10 years old to a senior citizen that has lens opacification and everything in between. What a wonderful opportunity we have to help the world see things a little brighter, a little sharper, a little better. And J&J's been a wonderful steward 2 months into it. We certainly have our integration pains, just learning how to navigate through the Johnson & Johnson processes. But I assure you the pros weigh the few negatives.
So you have a small, someone could describe it as a weak position in the back of the eye. What are you thinking? You have
It's
plans
true,
there to take on these guys?
Yeah, no, I think when we look across the portfolio, we're blessed to have a very solid pipeline, but it is more anterior segment driven. Cataracts is a big part of our business, but we also need to kind of build or reinvigorate the corneal refractive business. But clearly the back of the eye is a gap. I would say glaucoma is a gap. We play in a small space today at the far end of the disease state, but we need to get into the mild to moderate glaucoma patients as well. So I would say back of the eye, glaucoma, and to a certain degree dry eye are all areas that we're very interested in expanding our portfolio to.